Hello, now I would like to talk about diabetes in pregnancy. So this normally gets picked up towards the end of your pregnancy, and you might have noticed some symptoms like you might be being very, very thirsty, you might be going to the toilet more often. So gestational diabetes, can be more common if you've got a history of diabetes in your family, but some women just do develop it randomly and then, it goes after you've had the baby and they never get it again. So it can be controlled very well through your diet. It's certainly something that's getting picked up more often now. I think the measures that they're testing for it more often. If you have had a positive result for the diabetes test, then you really want to be basically controlling it as much as you possible with your diet. And I'm sure that you would have been given some good advice around that. So you want to go for foods with a low GI index and avoid all sugars. And sadly, that does mean fruit. So I did have one poor lady who could only eat brown rice. So she had to have brown rice with every meal. She had to have brown rice with eggs for breakfast. She had to have brown rice with beans for lunch. And she had to have brown rice with, something else again for dinner. But it did keep her diabetes very well controlled. I had another lady who found that her blood sugars really went up after her main evening meal, and that she was able to get these down again after she'd eaten her meal. If she went for a little walk around the block, that would really help her to metabolise those sugars in her bloodstream, and her readings would be much better. So the main kind of worries with somebody who's got diabetes are that they're worried that you might have quite a big baby, and then in that case they will be measuring you more carefully, and will also be thinking about possibly inducing you earlier than your due date, so quite commonly around 38 weeks, because they don't really want you to deliver a big baby. So if you feel that your diet is really controlling this very well, and your baby is a sort of normal size, then you might have a little bit of kind of negotiating in around that sort of time, but acupuncture can really support you. So sometimes this is something that people might feel quite anxious about, and the pregnancy's been going really well and suddenly this big curveball has happened. So if that has happened to you, then basically acupuncture can just support you through this. So it's sort of more kind of treating the physical aspect, the physical symptoms, and treating you for the emotional side. And if you are going to be induced at 38 weeks and you would prefer to have a natural delivery, then it's really great to come for some pre-birth acupuncture, which I will talk about separately, which will help you to be more likely to go into labour before your due date. So that is the biggest advantage that acupuncture can offer, and that is the reason why most women who are diabetic will come to see me.